Hi everybody, my name is Shana, and today we're going to be putting our Toff matrix band retainer and matrix band on number 29. We are going to get it ready to do an MO restoration, and we're going to start by kind of going over what has been done so far. Of course, we've already put on all of our PPE, and we have assisted the doctor in topical and local anesthetic. He has prepped the tooth, probably with the high speed, and then some hand instruments as well as the slow speed. And we know that number 29 is the fourth quadrant, and that's the lower right area of the mouth. So if we count 25, 26, 27, 28, 29, here's tooth number 29. It's actually blue today. So we have our supplies here. We have, of course, our Typodont, which will have the tooth that we're going to be working on. We have a Mirror Explorer cotton forceps, the Toff matrix band retainer, as well as our actual matrix band, and a wooden wedge. So we're going to start off just by going over our matrix band. The matrix band has an occlusal edge, which is this sharp pointy edge over here, and then it has the gingival margin edge, which is kind of the V right here. And we're going to want that gingival margin edge to be toward the gingiva, of course. So we'll kind of put it in that shape. Our matrix band retainer, I have it facing upward where the slots are because that's where I'm going to put it in. But instead of putting it in upside down with the occlusal edge facing up, I'm going to put it with the occlusal edge facing down so that when I flip it over and get ready to put it on number 29, it will actually be in the correct position. So we're just going to put it in these diagonal slots, if I can keep a hold of it. We'll put it in our diagonal slots. And then we are going to turn it to our left initially. That way when we flip it over, it will be in the correct position. And then we're just going to tighten that up and get it good and tight. That way it doesn't let loose during the procedure. And I'm going to take my mirror handle and I'm just going to kind of contour that a little bit to be a little closer to the tooth's natural anatomy. So now once we turn it over, it's actually going to go right into the mouth on that buccal side of number 29, and it's going to be going in the right direction. And again, we have our gingival margin here and our occlusal edge on the top. So we'll just put that down on number 29, get it seated in there. And then we're going to use this inner knob and we're going to turn and we're just going to tighten it up until it is in a tight shape. And we have a little bit of the band sticking up, about 1 to 2 millimeters over the top of the occlusal surface. We're just going to keep tightening that till it gets good and tight. We don't want it to wobble around or do anything like that. So we have it on there and it's tight, it's not moving. So there our matrix band is secured on there. Now as you'll notice, we have a small gap here between, I don't know if you can see that or not. Right in here in the embrasure where we need to place a wooden wedge in order to keep the material from creating an overhang or going somewhere where we don't want that material. And then we're going to take our wooden wedge, and I only have one size wedge. There will be cases where you'll need a larger or smaller, but this is the one that I have to work with today. And when you look at it, you'll notice that it has a point on the top, and then on the bottom of mine, it is flat. And the flat side is going to go down. So we're going to take our wooden wedge and just place it in between the matrix band and number 28. We're just going to kind of push it in there until we feel a little bit of resistance. And then we can look, and I don't see any of the gingiva in between the matrix band and number 28. So we have that contact good and tight, so we won't have any material seeping out of there. So after we've gone through the process of etching and doing any kind of bonding material, placing our composite and that sort of thing, after it's all been cured, then we are going to get rid of this matrix band. So first we're just going to kind of take that wedge out so it doesn't get lost or swallowed. And then we're going to take the outer knob and we're just going to release the outer knob until the matrix band retainer lets loose. We're done with that. So now we will take our cotton pliers and we will just kind of grab a hold of that matrix band and just kind of ease it off of there. And then you want to be careful with these because they're very sharp and you don't want to tear up any of the tissue in the mouth or on the cheeks or anything on the face on the way out. So then we'll just take this used matrix band and we will put it in the sharps container and get rid of it that way. So that is the way that we place and remove our Toff-O-Meyer matrix band. And of course, after we finish that, then the doctor would go on to finish the composite restoration and finish it, touch it up, make it nice and smooth, and we would be cleaning the area. And after we were finished, we would give the patients instructions, tell them there might be a little tenderness around the gingiva where the matrix band was placed, and that if they had any severe pain or it just wasn't getting better, then they could return to the office and we'd be happy to take a look at it. So thanks for watching my video on number 29 DO Toff-O-Meyer matrix band placement and removal. Thanks, guys.